maybe I'll start back a little further. Just what neuromyelitis optica is. This is probably well known to many, if not most people in the neurology community now. But 20 years ago, this condition was not really accepted to be a neurologic condition unique from multiple sclerosis. It was typically considered to be a severe form of multiple sclerosis. And I suppose the highlight was that it targeted, not entirely specifically, but relatively specifically, the optic nerve, causing blindness, and the spinal cord, causing paralysis. And really a game-changing observation occurred in 2004 when a group led by Dr. Van de Lennen, a neuroimmunologist at Mayo Clinic, discovered and reported an antibody pattern that was specific to neuromyelitis optica, and a year later discovered that this antibody reacted with a protein called aquaporin-4, a water channel protein that is expressed on astrocytes in the central nervous system. And this antibody test has become a universally accepted test that is very specific for multiple sclerosis and can differentiate neuromyelitis optica from multiple sclerosis. And an important observation made by a number of people was that treatments that we were using at the time to prevent NMO, I'll refer to it as NMO, it's actually known now formally as neuromyelitis optica spectrum disorder, or NMOSD, and I'll use these interchangeably, that treatments for MS did not work in patients with NMOSD. And in fact, some of the treatments actually seem to make NMOSD worse. So hence we came to the era of clinical trials and really understanding the pathogenesis of this disease, especially that it was an antibody-mediated disease, and understanding the effector mechanisms allowed a number of proposals for rational treatments, one of which was Inebilizumab. And Inebilizumab is in the family of B-cell depleting drugs. So in a sense, somewhat similar to rituximab, which had been used for some time. But rituximab targets the CD20 protein, which is on a more limited set of B cells than targeted by Inebilizumab, which targets CD19, which is also expressed on more mature B cells, such as plasmablasts and some plasma cells. And so there was some theoretical reason that Inebilizumab might be more efficacious. So now we come to the N-Momentum study, which was we now have 4 phase 3 randomized controlled studies that have been conducted, and all of which have shown very good efficacy for prevention of attacks in neuromyelitis optica. But the largest of those studies was the N-Momentum study of Inebilizumab. This was a study that the primary results were reported, it's probably now about four years ago, and involved just over 200 patients, the vast majority of whom were seropositive for aquaporin-4 antibodies. There was a small group that were seronegative. They were not on any, or not allowed to be on any other treatment. So this was a pure placebo study, and they were randomized. The primary outcome was time to first attack. And this was adjudicated at 6 months. And the results were highly significant, with a very good effect size of about 80% reduction in the number of attacks over 6 months. And there were actually positive secondary outcomes, such as reducing disability that was evident even in 6 months. Among the 4 clinical trials, the only one that had a positive signal for this disability endpoint. And the patients have been now followed for approximately 5 years or longer in an open label extension, and the efficacy seems to be entirely maintained. The number of attacks occurring has actually declined over time, so there seems to be very good long-term control. Now, just for disclosure, we have other agents that have also shown excellent efficacy, an anti-complement drug and an anti-IL-6 drug. So we now have a number of different agents, and we'll come to unanswered questions. And one of the big unanswered questions is, which is the best agent for which patients? And we don't have perfect answers for that question, but we can certainly return to that after we discuss this paper, which I know is the main focus of the interview.